All right, the back squat, a traditional exercise that I believe isn't taught with the same intent or the same uh, level of focus as it deserves, level of thoroughness as it deserves. So we're gonna try to keep this really simple, and we're gonna go over how to properly squat with a barbell on your back. There's two main concepts that I want you to focus on while squatting. The first concept is what we call whole foot, right? And that is the weight distribution amongst your foot needs to be even across the entire thing, right? So if your foot's on the ground, we're not on our toes, we're not on our heels, we're not on the outside or the inside. We're evenly distributed across the whole foot. This is going to give us a good connection with the ground. This is going to give us a stable platform to push off of and put force into this barbell to lift it all the way up. So that's a major concept. If you can just pay attention to where your weight is distributed on your foot, and it might be hard at first, especially with shoes on. I'm a huge fan of going barefoot when squatting. So if you're not really feeling where your weight is, do me a favor, take those shoes off, and start squatting barefoot and really feel where that weight is, because it's so important. And I believe that any kind of deviation outside of whole foot is going to be able to identify 95% of problems, of technical problems while squatting. Pretty much everything's going to go to to your feet. And if you're in tune with that, you will be able to feel it and hopefully make the appropriate adjustments. So that's concept number one. Concept number two is intra-abdominal pressure. This is a fancy term of saying the pressure inside of our abdominal cavity. My favorite analogy of this, and you can try this at home, is if you take an unopened Coke can and put it on the ground, you stand on it, what happens? Nothing. That can holds you up versus opening the can and setting it on the ground and standing on it. The can's going to collapse, right? So what changed? Well, in the unopened can, there's pressure inside of it, which helps rigidify, helps strengthen the walls. So you can look at your torso as that Coke can. And we want to build pressure inside of your torso to give it more rigidity, to give it more strength, to keep you safe and keep producing force into the bar. We don't want that force to go to the lower back, go to the neck, go to the shoulder. We want all that force to go right here into the bar. And to do that, we got to keep our posture neutral and tight. Okay. So how do we create intra-abdominal pressure? Well, it's tricky and it takes practice. It is a skill. Okay. So essentially what you're going to do is take a big gulp of air and you're going to try to expand your midsection 360 degrees around. Don't just think belly out. When that happens, a lot of people will go into extension of the spine, and we don't want that. We want to stay neutral. So really try to breathe into the sides, breathe into your lower back when you take that big gulp of air. This will help you help you stay in a neutral posture and not enter that extended posture. So after that big gulp of air that fills our midsection, then we're going to contract our muscles around our midsection to act as like a steel clamp. Okay, so this one's tough. There's a lot of different cues that we use to help athletes understand what that feels like. You know, pretend like you're about to get punched in the stomach. Everyone knows how to like tense up that stomach. That's one cue that we use a lot. Another one of my favorite ones is if we can take the top of our pelvis and the bottom of our rib cage and we can try to close that gap, right? Try to take this section and just try to clamp it down. Okay, that's going to help activate all those muscles, help keep that spine secure. So first we need the breath. We need to feel, we need that diaphragm working, and we need to build that pressure, and then we need that contraction. You do those two things and you hold that tension throughout the lift, your lower back will be safer, you'll be in better posture, and you'll be able to lift heavier weights. Okay. So now let's get into the actual squat itself. Bar heights. I'm gonna touch on rack heights just briefly. Guys, take the time to set up a proper rack height. If it's too tall and you're going up on your tippy toes to unrack it or to rack it, that's not good. You're putting yourself in jeopardy. If it's too low and you have to get under the bar like this to lift it up, any kind of serious weight, you're jeopardizing your back, and we don't want that. As well as putting the bar back, it's just more dangerous. Take the time, put the rack height where it needs to be. Most J cups have a pad on the back. Well, that's there for a purpose. That's that pad. When you step underneath the bar and you lift it up, the barbell should stay on that pad. If it goes above that pad, then your J cups are too low. And if you can't lift the bar off the cup without going on your tippy toe, well, then obviously your J cups are too high. So utilize that pad. It's there for a reason. You have that much space, room for error to get your proper rack height, but it is important, especially as you start to lift heavier weights. Okay, so addressing the bar, we're going to use the neural lines. The neural lines are these little lines. The neural is the texture of the bar. It's what makes it rough, more easier to grip, gives you a better grip. So, and there's lines in these neural lines that are the exact same distance from the center. So we're going to utilize that. So I don't care which finger it is. I'm putting my pinkies on the neural line. I'm going to extend my arms, which is going to center my chest. Okay, that's how I get center of this bar. We don't want to be offset on one bar and have one side, heavier than the other due to levers, right? So we want to make sure we're in the center. So to do that, find the lines, extend your arms, and then duck right underneath. Now, the bar itself, I like to, for all squatters to start off on, I like a mid bar, right? That's where the bar is right on top of your scaps. Yes, there is a high bar and there is a low bar where it's on your scaps or underneath that top ridge. It does adjust the mechanics a little bit, but for this video, we're gonna stick with a mid bar squat position, and that's where the barbell rests on the top of your scaps. You should have a nice little shelf there. Okay, so underneath, find that shelf, put that bar right on it. It's really important to get your feet underneath the bar. Okay, don't try to lift up the bar with your feet back here. Step underneath the bar, get your feet square, stay balanced, and lift the bar straight up, maintaining contact with the rack itself. Okay, then from here we can start our walk back. And usually we like a 3-step drop. 1, 2, and then match. Okay, then we match the other foot. As far as squat stance goes, there's no one size fits all squat stance. Everyone's built a little bit differently. So we need to take that into consideration. When we're squatting. So don't try to copy someone else's squat stance. Figure out what feels good to you. Essentially, there's just parameters of the squat stance, right? So we're thinking, shoulder width, maybe just a tad outside of shoulder width, all the way into almost touching. Okay, this is unacceptable. This takes crazy hip mobility and ankle mobility, but there are some excellent lifters who do squat like this and they're extremely powerful. So I can't do that. My body's not built like that. So it's just a matter of finding what feels comfortable to you. As far as how wide your toes are out, Again, ankle mobility, hip mobility comes into play as far as where your toes are pointing. If your ankle mobility is not quite there, then you may start to go out a little bit. My ankle mobility is not the best, so I squat where my heels are underneath my shoulders, and I'm probably 30 degrees pointed out. Okay, but remember the concept, the first concept, whole foot. No matter what your stance is, we want to keep your weight evenly distributed across your foot. That's the important piece right here. Not necessarily your stance itself, but maintaining that whole foot. Okay, again, hop under, feet underneath us, standing straight up. 1, 2, match, get in your squat stance. So from here, this is where we start the breath, right? So we need to get that big breath in through the mouth, blowing out the belly, or excuse me, not blowing out the belly, but blowing out the torso 360 degrees around. Don't just think belly, please. Okay. So I think breathing into my lower back is what I personally think. And then from here, then we're going to activate those abdominals, right? Then we're going to create that brace, that activation, that steel band that around our torso to help increase that pressure and give us more rigidity, more strength, more safety. Okay. So again, big breath, big brace. The talk test is a great way of determining if you're bracing right. If you can talk normal like this, you're probably not bracing correctly. So if you have a little labored voice, that's probably okay. And then from here, I'm gonna not brace for that reason, so I can talk. Okay. Then from here, it's a simultaneous break of the knee and hip. Okay. A lot of athletes will go knee first because they're trying to keep their chest up, and that's not necessarily true. We may discuss that here in a little bit, but knee break and hip break all at the same time, pulling the bar into the ground, staying whole foot, keeping the barbell over the center of your foot and standing straight up. The bar path, if you have a camera, that's a great angle. This is a great angle to video so you can see if that barbell is moving back and forth. If it's doing that, you should be able to feel that in your feet. So really just pay attention to where your weight is distributed on your feet, and it kind of catches everything. Okay. So big breath, big brace, break of the knees and hips at the same time, keeping the barbell over the center of the foot, sinking down and standing up. Okay. Let's go into this chest posture. So a lot of coaches will tell you to look up and to keep that chest up and all that stuff. And what that does is that just enters that extended posture, really takes out your hip mobility and puts a lot of force on your lower back. And we do not want that. Okay. We do not want that. We, on the other hand, we don't want to slouch. Like we don't want to squat like this either. So, they may be saying chest up to get you out of this posture, but I see a lot of athletes take that way too far and end up hurting themselves. So making sure we stay braced, but essentially the chest is connected to the spine. So as I go down, my chest is facing like, I don't know, 5 feet in front of me. It is not facing the wall in front of me. In my head, my eyes are looking exactly where my chest is looking. This will make sure I have a neutral neck posture. Okay. If my chest is looking down and I'm looking up, then I lose posture in my neck, and I don't want that. I want neutral posture. Okay. So don't be too concerned about keeping the chest up. We just want it proud. We don't want it collapsed. but be more concerned with those two concepts that we talked about. Okay. Big breath, big brace, maintaining whole foot the whole time. To rack the barbell, find the pads of the J cups on both sides and then lower directly on the cup itself. I see athletes have like a great squat with heavy weight, and they go and they try to set one side of the bar on one cup, and then they go to try to set the other side of the bar on the other cup, and the first side comes off and they don't realize it, and then they drop it and they're in this funky situation that could cause injury. So make sure you find those pads and drop the barbell straight down, prevent injury, and it's just what it's used for. So that's the back squat. I believe I covered everything. Two main principles: whole foot, intra-abdominal pressure. You do those two things, and I believe you're going to have an excellent squat, safe squat, strong squat with good technique.